we're taking a look at what's going around this morning, and joining us in studio is Dr. Kessinger from Integris to answer all your questions about prostate cancer awareness.
Yes.
Now, is this the special month for it?
Yes.
Okay.
September is the prostate cancer awareness, and it's a big deal because it's one of the biggest cancers we find in men, obviously, because men have the prostate. And so about 1.4 million people get a new diagnosis every year.
Wow.
And it's about 30% of the cases of new cancer diagnosis. So it's really a big deal, and it's big awareness because it's not something that gets as much, screen time as like breast cancer, or lung cancer, or skin cancer, or something like that.
We know this affects men, but when and what ages should we be looking at for screening?
So really so there's some pros and risks about screening for prostate cancer, because prostate cancer tends to be a slow growing cancer, so it's something not quick. So if you have a short expectancy, we're not going to push the screen for it because it's not going to do that. But if you're a higher risk individual, we're going to start screening. Usually the average typical man, we're going to start screening at 50 if there's no family history of it. So we'll start screening it and discuss the pros and cons. If you have a first degree relative, so a dad or a brother that got diagnosed before 65, or you're a black man, we're going to start talking about that diagnosis screening at 45. And then if you've had 2 family members diagnosed before 65, we're going to step it down to 40. So we really want to start when we're younger to decrease the risk so we can start screening and looking for it, because what we're trying to see is if there's a change in pattern in those prostate levels. It's typically we do it with a blood draw, so it's not very invasive at the doctor's office. But again, if you know your family history and you know that risk, we want to discuss when's the best time. So there's not a start for everybody. It really just depends on the risk factors.
Yeah, and is there any signs, I guess, that you should be coming in early for a screen, or that you may actually even be dealing with prostate cancer?
Not typically, because just with testosterone and prostate, there's a typically development of issues with age. So the longer that prostate exposed to testosterone, the more prostate symptoms we can have. So there's really not a symptom that you can feel.
Okay.
Now, I will say urologists that do prostate exams all the time have a great sense of what they can feel and what they can't, but the average person, even like the regular primary care provider, isn't adept at feeling that well. So it's really a matter of screening and looking for changes in your prostate specific antigen that we're looking for to see if there's a change that will entice us to look further, maybe get a biopsy and see if there's more going on.
And why is this so important to catch early?
So again, the sooner we find out with it, the easier it is to treat. And again, since it's an asymptomatic cancer, we're not going to find it without some surveillance. So again, younger we are, the more likely we are, the sooner we find it, the more likely we can intervene a lot quicker and have a lot less side effects and decrease the risk of metastasis. Whereas if we don't catch those, there's a lot more risk of complications, more invasive treating. And we just want to catch it early so we can, it's like any cancer. The soonest we catch it, the less invasive, the better the outcome, and the better the quality of life long term.
Yeah, so there you go. The better you're going to be if you can catch this early. So make those doctor's appointments and don't skip them.
Yes, and we don't mind talking about it, so please bring it up. Bring it up.
Ask the questions.
Yes.
And hey, speaking of asking questions, Dr. K is always here for you and ready to answer any questions that you have. All you need to do is go to our Facebook page and post the question there. You can also email it to us at news@okcfox.com. Thanks, Dr. K.